Hello, everyone. Hello. I'm just going to give people a few minutes to log on. Hey, Trinell C2. Hello. I am Dr. Myla Bennett, board certified plastic surgeon practicing in Johns Creek, Georgia. Tonight is a liposuction live stream. Welcome. So I usually don't go live from this Adarabella page, but I'm going to do better. And it's since I'm talking about, someone said no sound over here. Can you guys hear? Oh, and let me see if I can hear. Let me get the chat going open over here. Hello, Faithful for Life. Hi, Adeline. Hi, Charlotte Jackson. Hi, Ikea. Hello. Hey, Shadon. Thank you. Can you guys hear over here on Instagram? Yes. Okay, good. So whoever that was who said they could not hear, you might want to go out and come back in. Great. So we got YouTube and Facebook up. I told y'all I'm gonna do better. I got a computer and 2 phones going to catch everybody. Yay, Boss Dog Keisha says she's booked for 228. For consult, must be because I don't, unless that's a name that I don't recognize. Hello, Fluffy Dior 18. Welcome. All right, so tonight we're talking about liposuction, and awake liposuction specifically. The benefits of it, who's a good candidate for it, what does liposuction entail? A lot of liposuction is ever since I moved to Georgia, which I moved here in 2015, that is the most common thing that I do. I am known for doing natural appearing work. So I don't do the exaggerated forms and, I do, my goal is to make it so that if a stranger sees you on the beach, they don't look at you and know that you had lipo. You just look like you're fit and healthy and just got a nice body. And so, I aim for natural appearing results. My patients still look soft like a woman. They're not so I don't get a lot of people with fibrosis and stuff like that because I don't do those extreme things that makes you more amenable to those things. So let's just start off. I see the first comment saying, wish the BMI was higher to qualify. Let's talk about BMI and liposuction because people think, we're just being mean saying, BMI requirements are lower. And my BMI requirement is 33, which is still considered obese. I'm not asking anybody to get little. There's a lot of surgeons whose BMI requirements is 32 or 30. But mine is 33. And that was the number that my complication profile for my patients was low. Satisfaction was high. And that's pretty much the 2 things I'm really shooting for. A person who's happy with the result and who is free from complications. So the reason why higher BMIs make you more at risk for complications is for a few reasons. One, fatty tissue is not as rich in blood supply as like muscles, right? So the thicker your fatty tissue that we're working in, the less there's less blood vessels running through it. So then antibiotics have a harder time getting there. Healing cells have a harder time getting there. And so the higher up your BMI goes, the more incidence you have of infection, wound healing complications. And one of the things specifically with liposuction, as your BMI gets higher and higher, so let's say your BMI is 40, okay? This group of people has a higher chance of having an undiagnosed hernia, like a hernia that we're not able to feel on exam because the fat layer on top is too thick for me to be able to palpate on physical exam if you have a hernia. So now if you have a hernia, I need to draw pictures. I should have had paper. Give me 1 second. I'm going to draw you guys a picture. Hold on. You guys know I like to draw pictures. Okay, I'm back. Now y'all gotta give me a second to actually draw. Okay. If you have a hernia and it's not caught prior to surgery, this is where you end up with people with like injuries to their intestines, which that's the type of stuff that could kill you or give you really bad complications. Okay. So let me draw a little picture here of what a hernia. Okay. All right. So this is very basic, this picture, okay? But just so that you get the idea. So imagine that, hold on. Back, front. Okay, imagine that I'm laying down on the table and somebody takes a guillotine and cuts me like this. And this is it's called a cross section, okay? So this outer layer is skin. Then this layer here is a muscle layer. This layer here is muscle layer, okay? The fat that we liposuction is in this white space. And here is organs, okay? When a person has a hernia, the organs outpouch into the fatty tissue that we are liposuctioning in. If you got this going on and I'm not able to feel it because your fat layer is so thick, and then I go and I stick a liposuction cannula in there. Oh, sorry, can y'all see that? I go and I stick a liposuction cannula in here and I'm going all through here with this lipo cannula and you have intestines sitting up in here. This is bad. This is bad. When people tell you, oh, I specialize in high BMI people, that's usually not real plastic surgeons that do that. They're not doing these types of things on somebody whose BMI is 40 and 45. Liposuction isn't a weight loss procedure. So you want to be in a situation where we're able to feel if you have a hernia that has not been diagnosed yet. Because if you're really overweight, you can have this. And the other thing is the higher your BMI, the higher your risk of hernia. Okay, so people think folks are just being mean, and then they go and listen. The scriptures say, y'all know I love the Lord. The scriptures say there will be a time when people will only want to listen to whoever is saying what their itching ears want to hear. So that those people who are preying on you because they're just trying to hit a lick, and they're saying we specialize in higher BMI people. If the BMI is 40 or 45 or something like that, you don't want to be getting liposuction. I would even do a tummy tuck before I did liposuction on somebody who's got a really high BMI. Because when you do a tummy tuck, you see everything, and liposuction is a blind surgery. We're working through incisions this big, and this cannula literally just operating by feel, you know? And so somebody, if like I said, if you've got this going on, and nobody can feel it because their fat layer is so thick, this is dangerous. This can hurt you really bad. Okay? So I don't recommend if your BMI is 40 that you go looking for somebody to do liposuction on you. What you really need to do is lose weight. Liposuction is not a weight loss procedure. It's not a weight loss procedure. And the other thing, you know, when I used to do BMI of 35, and then I dropped it to 33, and then that made my life so much easier. Because when it was my BMI cutoff was 35, I had more patients who were, they would be like, you know, coming to their 6-week follow-up appointment, like, I don't know, I just feel like I spent all this money and I don't really see a difference. And I'm like, lady, I just lipo 6 liters off of you. It's definitely a difference. Like I took off 6. You know how much work that is? The bigger the person is, the more work it is. And then so it makes me feel bad if I did all of this work and you're saying it looks the same to you. Like, it was because the bigger you are, the more has to come off. But I'm not about to take off 10 liters. That can hurt you. We're back to hurting somebody again to try to get to a particular end when really what needs to happen first is the person needs to lose weight. If you need to lose weight, you need to lose weight. And let me tell you why the weight loss thing is so important. Forget about liposuction. If you want to live a long time, I don't care what they tell you. Black people like to carry more weight. We thicker, we bigger bone, all of that stuff. We also have the highest rate of death from diabetes, hypertension, heart disease, and cancer because of weight. That's one of the reasons. The heavier you are, the earlier you die. That's just facts. I don't know any overweight 90-year-olds. When people live to be old, they're little. So the fat that's around your organs, there's visceral fat and there's extra abdominal fat. The fat in this region is extra abdominal fat. The fat inside of here wrapped around your organs is called visceral fat. This is the fat that makes you have high blood pressure, diabetes, and all of that kind of stuff. This is what makes you have those things that can hurt you. So if you need to lose weight, the only way to make this fat go away that's around your organs is with weight loss. Now, there's surgeries that can help you with weight loss, like gastric bypass and sleeves and stuff like that, because they make you lose weight diffusely. But liposuction can't be done here. So somebody said that's why people go to the Dominican, because they do aggressive lipo. Exactly. And that's why people die there. People die there. People die here too with these crazy places that operate the same way they do. But those places that don't have any boundaries as far as patient selection, anybody who wants it can get it. That they have a lot of complications and a lot of deaths. So at the end of the day, it's an elective thing that we don't need. We want it, and so what you want is to come out of it healthy and whole and alive. So if you need to lose weight, just lose the weight, then come get the surgery. Lose some weight and then come get the surgery. Okay. Someone said, what are the risks of having lipo 360 for someone who is a borderline diabetic? Okay, so diabetes increases your risk for infections that are bad. But if you don't have diabetes yet, then you're good. If you're almost to diabetes, but you don't have it, you'll be fine. But if you have diabetes, your blood sugars need to be under really great control. Because once you have surgery, your blood sugars go crazy for usually about a month or so. It's a little harder to control your blood sugars. So we really need things to be, I meant to pull up pictures. So I just saw somebody's question there. I meant to have pictures available to show for liposuction people in their 50s. I like women in their 50s. I like women in their 40s too. I'm 45. But it's just that group of people are they're settled. They follow instructions. They're not strapped for cash. You shouldn't be getting plastic surgery if you can't really afford it. And so it's just like, it's just they're just more grounded. What's your opinion on a new procedure or new to me that helps with cellulite? The cannula have a little hook on it at the end. Yeah, that's a good procedure. We all need to lose some weight. Absolutely, me too. I'm always losing weight. I'm always trying to lose weight. For the very reason I told you, I want to be 90 so I can see my children grow up and see what they do with their lives and meet my grandkids. And I just had an epiphany about a year and a half ago. I'm like, I don't know any fat 90-year-olds, so I need to lose weight. I was looking at my son thinking like, dang, I want to see what he becomes like, just, how you look at your kids, sometimes you're just like so proud of them and they're so smart and they're so talented. They're so this, they're so that. And I was just thinking like, I just can't wait to see what God does with him. And I just, started thinking that I wanted to be here to see it. And I started thinking about, like, I don't know any overweight 90-year-olds. That was pretty much it. I was just like, I'm not going to be 90 if I don't lose some weight. What if you have mild chronic kidney disease? Is that what you mean by CKD? Things like that. Those are consult questions. Like, I can't do medical advice over Facebook and YouTube. So, this is why you have a consult. Someone asked me yesterday, if I know I want surgery with you, can I just not have a consult? Like, no, I'm not doing surgery on somebody I haven't met, and I need to make sure you're appropriate. I have 2 sons, but when I had that thought, I was speaking of a particular son. I was looking at him as he was doing something, and I had that thought when I was looking at my oldest son. Of course, I want to see. I am in love with both of my children, but when I had that thought, that was a real thought. I didn't make that story up. I was interacting with my oldest son when I had that thought, and so that's why I said that. Thank you, Two Tone, so pretty. I do my skincare. You look great drinking your college out. What's with all of the compliments today? Why y'all trying to butter me up? Thank you. Yeah, so things like that, Adeline, we need to go over your stuff, and make a plan to safely get you through a procedure. How do you know if you have visceral fat? Everyone has some visceral fat, but the amount is the issue, right? So if your belly's sticking out and it's not really a lot to pinch, you for sure have visceral fat. If your belly's sticking out, period, even if you have pinch, you definitely probably have some extra visceral fat. If you are carrying extra weight, you've got extra weight around your organs too. That's just, how many sessions of MLD is that manual lymphatic drainage? Y'all, I'm not good with abbreviations, so type the words out for me, y'all. Massage you recommend after your liposurgeries. I have people get at least once a week for the first 6 weeks minimum, and some people get them more than once a week. It depends on how you're healing. Thank you, Lucky Lucy 4. What about diastasis recti with BMI of 29? So a lot of people have diastasis recti, and the BMI of 29 is great. If my BMI is 33, then 29 is going to be fine, right? So 29 is fantastic. The diastasis recti, I need to see. Having a rectus diastasis is not a deal breaker for liposuction. If you have a big wide one and very little fat, then you need a tummy tuck. If you have a nice, got a nice little pinchable amount of fat and a small or average diastasis, sometimes, here's what happens sometimes. I do the liposuction. You get put in a compression garment, and the muscles are sitting like this prior to the surgery. I do the liposuction all up here, and the muscles sitting there. And then we put you in a compression garment, and it pushes stuff together. And then you start healing for the next 3 to 6 months. And you're laying down scar tissue, and you lay it down on top of this where this diastasis was, but the muscles are hanging out like this because of the compression garment. Sometimes your scar tissue acts like glue and holds it there. I had a few people go flat like that when I was earlier, back in 2016, when I first started really getting heavily into liposuction. And I'm like, you need a tummy tuck, you need a tummy tuck. They're like, I don't want no tummy tuck. I just want to get some of this fat off. I ain't getting no tummy tuck. Please, can I just please have lipo? I'm like, okay, fine. Your belly not gonna get flat though. I'm just letting you know it's not gonna get all the way flat. And they're like, okay, doc, if I could just get it to trim down some, I'm good, right? I'm like, all right, bet. I did it, and after they finished going through the whole process of compression and everything, their bellies went flat, and I was like, ooh. So that's when I realized it depends on the type of scar tissue you make. Some people make heavy scars. Some people make loosey-goosey scar. If you got loosey-goosey tissues, it's not going to work. But if you make a pretty decent scar tissue, it'll hold it together like glue. So diastasis recti is not a deal breaker. How long is the quote good for after consultation? I think my form say like 30 days or something like that, or 90 days or something like that. But honestly, I've changed my prices maybe twice since I opened my practice 7 years ago. If my prices don't change, your quote will be fine for a year. I'm not anticipating changing my prices anytime soon. So I won't guarantee it beyond 30 days. But if my prices haven't changed, your quote won't change. As long as you haven't physically changed. So like, if a person whose BMI is 27 getting liposuction, the price won't be the same as somebody whose BMI is 33. It's a lot more work, right? So that's why when people be asking me for prices, like this ain't Wendy's and you can't just pull up on the menu and pick out what you get. That's not how it go, because it depends on some people. If I have a person, a woman that's 6 feet tall and she got a BMI of 33, that will not be the same price as somebody 5'1" with a BMI 27. It's not. It's way more work for that 6 foot tall BMI 33 lady. That's a lot more work. So the price won't be the same. So I don't give prices like some people do that. That's on them. That's not what I do. So I don't, I can't tell you the price, but I can tell you the price will probably be that price as long as you stay the same size. The price will be good for a while. Dr. Maya, I follow you. I think I may be your only faithful male follower, but I have a serious question. Do you work on male body? Do you work on men too? If so, I'm coming to see you. I do have some male clients. I do. Mostly women, but I have guys. Usually the guys that I end up servicing are the husbands or boyfriends of the women that I've already done work on. That's usually where guys come from. Just to confirm, if you pinch your fat and do not have much skin, I think that's the end of the day. You will not have loose skin. The indicator, one good indicator that you probably won't have loose skin is if you have 0 stretch marks and nothing's hanging. Although stretch marks is not a guarantee that your skin won't shrink at all. Like, it depends on the kind of stretch marks you have. There's different types of stretch marks. Some people have real shallow ones and some people have really deep ones. And so stretch marks is not a guarantee that your skin won't shrink either. But if you don't have any stretch marks and your belly's sticking out but it's not hanging, it's probably going to shrink. I'm in Johns Creek, Georgia. Can a diastasis recti be reversed without surgery? I mean, I don't know how that happens. If it does, I'm not sure how to do that. Except for right after you have the baby. Okay, so right after you have a child, like while you're still postpartum, like that first 3 to 6 months after you birth the baby, especially if you're breastfeeding, if you wear compression, if you go and put on one of those like post-lipo garments right after you have the baby, it's going to push those muscles back together. Your body is naturally, everything is shrinking. Everything is trying to shrink. And you go put a garment on and push that stuff back together, it'll help close up that diastasis. But you only have a short window after you've had the baby to do that. If you had the baby 2 years ago, it's too late. But if you just had the baby 2 months ago, you might still be able to do it. And certainly if you are pregnant or you get pregnant and remember this conversation, get a compression garment for after you have that baby. Like with my kids, I got fat on my belly, but I don't have a diastasis. But with all 3 of my children, I wore compression right after. And I mean, I gained weight after I stopped breastfeeding, but I lost all of my baby weight within a couple of weeks of having my kids, but from nursing and compression. Then when I stopped nursing, I blew up 20, 30 pounds with each kid after I stopped nursing. I'm like, I was an anomaly. And you would have thought I would learn my lesson after the first one. After the second one, no, I did the same thing with all 3. Can you do a wake lipo? I have a little fat spot above my buttocks. Can you do that with wake lipo? Absolutely. What is the highest you'll go BMI? 33. 33 is my general cutoff, and that's normally the number. Sometimes I'll get a person that are really bottom heavy. They're hippie, and their belly is normal. then I'll do their BMI might be 35 and I'll still do it because they're not thick in the belly. They got big old thick hips. You know how some people are built like that? So if you're built like that and your midsection is relatively small compared to your hips and your BMI is like 35, I'll do it. I really want to have lipo on my arms, but scared of having floppy, loose skin if it doesn't retract. Yeah, and so that's where examining the skin quality prior to and having discussions about what's realistic for what you have going on is important. Because that's a very good that's a real concern. And especially with arms, it definitely looks better fluffy than flappy. Like it's better to just let the fat be there. People keep telling me my voice is soothing. That's just so interesting. Oh, so you'll be happy to know I'm working on an app and I'm going to be doing reading the scriptures like in 10-minute chunks. And I'm also going to have daily guided meditations for the people who subscribe to it. So you actually might enjoy that because it'll be a whole lot of my voice on there. So hopefully I'll have that ready in the next 2 or 3 months. Does a wig lipo tighten skin? So lipo is not a skin tightening procedure. However, all liposuction, it doesn't matter if you're awake or asleep, liposuction itself, your skin contracts more than it does if you just lose weight. Like the inflammation that comes with healing causes, and the garment and the compression garment causes skin contraction. Administrative account. Who is that? Is that the YouTube police? Do you do lipo on the tummy and back on the same visit? It depends on what size you are. Do you mind explaining how gluteal contouring is performed with Lipo 360? Not sure if I'm asking what I really mean. I have a whole video with pictures on that subject and draw the picture. I mean, whether it's Lipo 360 or Lipo of the back or Lipo, it's the same. Gluteal contouring is the same. I have a video with that. That's right. She said, my grandma will always ask me after I gave birth, you have on your girdle. Bind it up. It makes such a huge difference. Keep those boobs in a bra all the time after you have that baby. When you're nursing, you should never sleep in a bra, everything. And that keeps your boobs, that helps keep your boobs from heading to your lap. And then, oh, that's just your name on here. I'm like, administrative account. And then bind up your belly. Your stomach will go down like in 2 weeks. It'll be flat. It'll be flat. Does age matter? No, your health matters. So that's what I'm paying attention to, your health. If you are in pretty good health, like you can have high blood pressure as long as it's under good control. If you have diabetes, it needs to be under good control. Like I need your hemoglobin A1C to be below 7. And if you got a list of medicines this long, it's you need to be getting your health together. But if you 1 or 2 medications, a little touch of hypertension, that's okay. Why is it important to be a certain BMI before surgery? I would like to get a tummy tuck, but want to stay the size I am. I would recommend you watch the replay. I don't know what size you are, but you can stay the size you are. You are. It's just people. I just won't do it. If you're too big. because the complications are just higher. It's just more, it's way more risk the bigger you are. And it's a surgery that we don't need. And so it's just not, I don't knowingly go into situations where I'm almost guaranteed a complication. I don't like complications. Have a defibrillator, would I be able to get a 360? Possibly. Does multiple C-sections matter? Nope, it does not matter. Sleep with a bra if you just had a baby and you're breastfeeding. 40 ain't no punk. Yeah, you probably ain't. See, the thing is, I was just speaking about postpartum, and a lot of people will be, can I ask a personal question via email, Dr. Myla? Dr. Myla, if it's about surgery, then you need a consult. I won't do consults through the email. So is it okay if we do it after Lipo 360? Yes, it sure is. I'm located in Johns Creek, Georgia. Don't send me pictures in the DMs either. Don't send pictures in the DMs because I won't. I don't do practice medicine in the DMs, and I don't work for free. So if you send me pictures saying, I just want to know an idea, that's not how my practice works. I know there's places that do that. I don't. So I'm not evaluating anyone through the DMs, and I'm not evaluating anyone without a consult. Yes, we do virtual consults, Andy Mackey. I have lots of Texas people. All right, I think that's good. It looks like I answered most of the questions. So you can hit up if you're interested in a consultation, you can go to www.drmylapowell.com. www.drmylapowell.com. Yes, I'm offering a Wake Lipo right now, Ms. Bougie 54. How soon can an out-of-town patient travel back home? It depends on if you need to take a flight back home or not. So if you're like a few hours away, driving distance, you can leave the next day after your follow-up appointment. You got to come back at 4 to 6 weeks for a follow-up with me, though, in person. If you're flying home, you got to wait 5 days. I have a consult with you last month. I'll be in town week 220, so you want to see me in person. I have no idea. I don't know who you are. If I said that, then I don't know who you are. I don't like that. Those kind of personal things, call the office and get clarity. I don't know. Your name is unavailable. No, is no picture. I don't know who you are. So I can't answer that type of question. Yeah, every patient has to have blood work. Every patient has to get clearance from their regular doctor. Someone asked, does out-of-town patients need to come with blood work? Everyone has to have blood work, and depending on your age, you may need to have an EKG also. I need clearance from your doctor. Yes, consultation 2 years ago is probably not, you need to just call up there. You don't have to pay for a consult again though. So if you had a consult with me before, you don't have to pay for a consult again, but you can call and be like, hey, I had a consult a few years ago and I'm ready to book surgery. What do I need to do? I'll probably just have you send pictures in for me to see what stuff looks like. And we'll talk again. You just won't have to pay for it because I want to check your health, your medical history and stuff. It's been a couple years. Can I just get lipo on my lower stomach? That's where my fat is. That is a great question. I never do that. It's a whole abdomen or no abdomen. So a lot of people ask that question because you're conscious of the part at the bottom that's hanging. Whenever people get a half an abdomen lipo, it always looks bad. So I won't lipo a half of an abdomen. I won't do it. It looks bad. You think that's all you need, but it's not. I'll take that part off and you'll notice the fat at the top. So to make it look right, if you can't afford to get the whole abdomen, then just save up until you can. If it's a matter of cost, if it's not a matter of cost, then it's not a good idea to get half of your belly done. Don't do that. There's lots of places that will do that. They're like, oh, Lower abdomen. I do like it. It doesn't look good. Trust me. Don't do it. So I won't separate something that I'm not willing to do because I don't enjoy doing stuff that I don't like how it looks when I'm finished. And a lot of times people think they don't need it. And just like people will be like, they'll get their front done. They'll be like, I'll just work out my bra rolls. They're not gonna work them out. It's not it's not gonna happen. They always say that. But that's in the back at least. I'm not gonna cut up an abdomen. I'll let them do that. They'll come back later and get their bra rolls when they see that it ain't gonna work. Oh, there's lots of procedures I won't do. Absolutely. I mean, I won't do regular lipo on somebody if I don't think that they're mentally ready. If I don't like them, like if I'm just like not feeling them, I won't do it either because it's like once I cut you, we're in a relationship. So we're having, and it's not, you don't need it. It's not like it's open heart surgery and I'm the only surgeon and you got to get it. That's not what it is, you know? And so if I'm not feeling you, I mean, I'm interviewing you too. People be thinking they just interviewing me. I'm like, look, chick, you can't make me do surgery on you. If I don't like you, I'm not doing it. I'm not getting into no relationship with you indefinitely. So you could drive me crazy. You know, I give my patients my cell phone number. If I don't want you calling my cell phone, I'm not doing surgery on you. See, the thing about me is I'm not chasing money. I will say no. Just like I'll say no to somebody who's trying to make me do half of their abdomen. No, just never, you won't have, just go somewhere else. I'm not doing that. I'm not doing it. I want it to look good just like you want it to look good. And I know better. You don't in that regard. You think you know and you don't know. You know what I'm saying? So absolutely, I say no all the time. And sometimes, folks will come in with a list of like, I want my this, I want that, I want my arm, and my this, and my that. And I'm like, girl, ain't nothing wrong with your thighs? Why are we doing your thighs? Why don't we just do your belly and back first and see how you feel about stuff after that and reassess? Like, I could easily go and just be like, yep, let's do these 6 areas and charge them $20,000. But I don't want the Lord coming to get me. If they don't need it, I'm like, girl, you tripping. If you just want to give me some money, just give me the money, child. But let's not be just doing surgery just to do surgery. How do you feel about the gastric bypass? I don't have no feelings about it. I mean, it helps people lose weight. I don't have nothing bad to say about it. I do a weight lipo on inner thighs also. Absolutely. Inner thighs, outer thighs, front of the thighs, back of the thighs, butt. What I don't do is calves and ankles. I ain't doing that. I do arms, anything on the torso, chin, all of that. I'm so glad you're still practicing as of now. As of now, that's the key. You see, I'm kind of pulling stuff back, pulling it on back. I'm pulling it on back. If you want me, you better get in while you can. The Lord is doing new things with me, y'all. They won't be walking up in your office jacked up talking about Dr. Myla. Exactly, LW. People think just because they ask for it, I'm going to do it. Get out of here. I'm not double board certified. I'm board certified. I'm board certified by Plastic Surgery Board. That's it. It's 33 for everything for me, Sassy Samantha. BMI is 33 for everything. Yeah. My practice is evolving. I'll probably get somebody in there with me maybe by the end of the year because the Lord is shifting me. Do you do top of the buttocks only? No, not necessarily. But typically gluteal contouring is the top. But if you need something else, then you know what I'm saying? Like that's typically what gluteal contouring is, but that's why we do consults because there's no one size fits all procedure. So if you need something different, then we'll do what you need. Tammy's tea. Is that how you say that? I remember you said make sure the word plastic is part of their title. Yes, exactly. So, all right, I think I caught most of the questions. We're gonna go ahead and sign off. What is a skinny BBL? I have no idea what that is. You know, I don't do BBLs. I haven't kept up with all the crap people doing with that surgery. That ain't my deal. I don't like that operation. That I ain't the person to ask about that one. I never heard of a skinny BBL before. That's a new one for me. Does the weight come back after lipo? If you gain a whole bunch of weight, you know, if you go and gain 100 pounds, yes. If you go gain a bunch of weight, yes. If you gain 10 pounds, no. But if you go gain 50, I mean, you gonna start seeing some things that you didn't want to see. Okay. All right. This was fun, y'all. Thanks for hopping on here with me. And www.drmylapowell.com. Is there likelihood of loose skin after chin lipo? Depends on what your skin looks like before the chin lipo. Yep, it could happen if your skin is loose before the surgery. All right, I love y'all. Oh, see you Wednesday, Trendia. All right, I love y'all. Check y'all later. Bye. Okay, let me see. I gotta end.